I'm Michael Roberts. I'm an orthopedic surgeon at Rutherford Orthopaedics, and I work at Rutherford Regional Medical Center. We offer total joint replacements of the hips and knees as well as the shoulders. So determining when it's the best course of treatment often takes time to go over the patient's history, their physical examination, their limitations, including x-rays and sometimes MRIs to be able to fully determine if that's the best course of action. And then to discuss what the limitations are and what the expectations are by doing the joint replacement prior to proceeding with that. But once we get to that point, the joint replacements of those three joints are tremendously satisfying for patients. Yes, sure there are. And we start with diet, supplements, pain medications, non-steroidals generally, injections of various types for the different joints, as well as exercises and therapy, all prior to proceeding with joint replacement surgery. And sometimes there's even minor surgeries that are available to do much less invasively prior to actually replacing someone's joint. So partial joint replacements are primarily for knees. The ones that are in the hips and in the shoulders are just for specific causes where there's isolated damage to just the ball of the hip or the shoulder joint. And those are much less common. The partial replacements people talk about mostly are in the knees, where just one of the three main compartments is involved. That really only truly affects about 5 to 10% of the people if you carefully evaluate all three compartments in the knee. So it's a far less likely that you would qualify for a partial knee than a total knee replacement. The other thing that we have to worry about with those is that as the other parts of the knee do wear out over time, trying to convert that partial to a total is a much more invasive operation with less reliably good outcome as a primary total joint replacement. So we proceed with those carefully and after very thorough investigation. The initial signs is just difficulty walking. You find yourself limping, particularly if you sit down for a few minutes and try to get up, or you're in a car and drive a good ways and trying to get out of the car and get going. It takes you time. Typically, it comes and goes. You'll have times where nothing bothers you at all and other times where you feel like you can hardly go. Those are the signs of the arthritis, and you can come in and get those evaluated. Doesn't mean you need a joint replacement, but we can start with the easier treatments and work our way up. But those are the signs that people often have initially. Provided that we've already determined that the joint is the problem and a joint replacement would be a good solution, they still have to be medically healthy enough to have that magnitude of an operation. They have to be willing to do the physical therapy and do the necessary recovery time on their part. So there's both medical reasons, and also recently studies have shown that if people are quite large, then the actual mechanics of the joints can have issues and have a much higher complication rate. So sometimes there's requirements for patients to lose some weight prior to proceeding with the surgery to optimize the excellent outcome. So for joint replacements, it's a little bit different between the three, but for the hips and knees, which are far and away the most common ones, they'll have their surgery. Within an hour or so of surgery, they will get up and walk around within their room and sit up in a chair and eat and start their therapy the day of surgery. They can anticipate 2 to 3 days in the hospital, doing therapy 2 or 3 times daily, and gradually even walking and doing stairs the day after surgery. And by the second or third day, being able to go home with home health or go home and start going to outpatient therapy. Pain relief for hips compared to pre-op pain relief is often within just a couple of days. And for knees, it can be up to 4 to 6 weeks before they're significantly improved, because the therapy works on the incision a little more and there's a little bit more pain and swelling following a total knee versus a total hip.